and question 17 is on page 89. Okay, you ready? I don't know if I gave you enough time. I can't tell because I don't see you. I hope I did. Anyway, let's go over them together. I'll try not to talk too fast here for you. All right, question 11. The 6 a.m. ABGs for a patient on a ventilator display respiratory acidosis. The physician indicates to you that he wishes to extubate the client today. What would you do? All right, respiratory acidosis. What is respiratory acidosis? Well, I know that that is under ventilation. So before I even read the answers, I always try to see if I can figure out the answer before I read the answers. No, I can't always. In fact, I'd say maybe half the time I cannot figure out the answer before I read it because maybe I don't know where the answer is going. Maybe it's a SATA question, whatever. I can't always, but if I can, I try to at least conceptually figure out what I'm looking for because that prevents me from overthinking. So what I say to myself is, well, they want to extubate the client today, but the patient is underventilating. So I'm thinking that may not be a good idea. So I'm looking for an answer that says, yeah, maybe that's not a good idea to extubate the client when they're already underventilating, when they're on the respirator, when they're on the ventilator. So let's look at the answers. Begin the weaning process. Okay, that's not what I was thinking. Increase the client's O2 and tidal volume while weaning the patient. All right, I like the first half of that answer. Increase the client's O2 and tidal volume. I like that. But the second half, I don't like. And here's a rule. If the whole answer isn't correct, the answer isn't correct. If the whole answer isn't correct, the answer isn't correct. You can like half of the answer as much as you want to, and you've got to practice this. Otherwise, you're going to be like, oh, I like that first half. Oh, I like that first half. I really like it. But the second half is wrong, wrong, wrong. So I can't pick it. I cannot pick it when only half the answer is correct. So C, question the order and discuss the ABGs with the physician. Oh, that sounds good. Call the respiratory therapist to see what they think of the order. All right, remember I told you, do not call another specialty to ask them what they think. That's not what we do. We can call other specialties to come in and do things that are within their scope of practice, but we don't call other specialties just to ask them what they think. They are testing to see if we know what we're supposed to do, not if the respiratory therapist knows what we're supposed to do, okay? So I'm crossing D off. That's never the right answer. So C is the correct answer. So 11, the correct answer is C. All right, 12. You receive the 7 a.m. ABG reports that indicate your client on a ventilator has respiratory alkalosis. All right, respiratory alkalosis. Okay, respiratory alkalosis is over ventilation. So let me see here. So it says they're over ventilating. So what would I do? Well, if they're over ventilating, I'm thinking we need to turn the settings down. Now I know I'm not actually allowed to turn the settings down, but I'm looking for something like that. Maybe it'll say call the respiratory therapist to turn the setting down. I don't know, but I'm looking for something like that because I know they're over ventilating. Okay, have the lab draw a repeat ABG. All right, now other data banks will tell you the opposite of this, but I'm going to tell you this and I hope you'll listen to me. Never recheck the same data, whether it's a lab, ABG, blood pressure, O2 sat. Never recheck it. You can do further assessment, like if you get a blood pressure, you can go and get the heart rate. But never, if they tell you what the blood pressure is, don't go, oh, I'm going to go recheck the blood pressure. That will not be the right answer because the NCLEX I told you is a perfect world. If you have an order, if you need an order, you have it. If you need some supplies, you have them. And the data that you're given is always right. The only time you can recheck data is when they tell you it's been incorrectly drawn. So if they say, the lab came up and drew the lab and it clotted in the tubing, well, then I need to redraw it. Okay, obviously I need to redraw it. But unless they tell you there's a problem, unless they tell you that, it's right. So we are not going to redraw the ABG because why would I do that? I know they're in respiratory alkalosis. There's no reason to redraw it. It's the right labs. Okay, so no, I'm not going to do that. Call the physician to discuss increasing tidal volume and rate. Well, they're overventilating, so I don't like that. C, discuss decreasing tidal volume and rate with the physician. Well, I like that. They're overventilating. D, continue ventilating at the current settings. No, I don't like that. We're going to talk with the doc about decreasing ventilator settings. Okay. Question 13. A client is admitted with acute cocaine intoxication. Which of the following signs and symptoms would you expect? All right, cocaine. Cocaine, first you say, is it an upper or a downer? Amphetamines, ADHD drugs, bath salts, caffeine, cocaine, PCP, LSD. So this is an upper. And then you say, are they talking about overdose or withdrawal? We're talking about overdose. So we're looking for up symptoms. And if it were me, I would write this down on my whiteboard so I don't make a mistake. So I'm doing SATA. Constricted pupils. No. Mydriasis is up. Mydriasis is dilation. Constricted is down. Meiosis. I didn't give you that. Sorry, I forgot to tell you that. Meiosis. Meiosis is constricted, and that's down. Agitation. Yep, agitation is up. Tremors. Yep, that's up. Belligerence. Yep, that's up. Tachycardia. Yep, that's up. Constipation. No. Flaccidity. No. Clonus. Clonus is a seizure symptom, so yes. So for 13, you should have picked agitation, tremors, belligerence, tachycardia, and clonus. All right, 14. A spouse abusing client says, I am not a spouse abuser. We just have a very physical relationship. Your response to this statement would be, all right, so they're an abuser, and the most common problem in abuse is denial. So he's denying it or she's denying it. I'm not, it's usually men generally. I'm not always, but usually. I'm not a spouse abuser. We just say, okay, so he's denying it. So how do you respond to that? You confront them with the difference between what they say and what they do. So I'm looking for an answer that shows I know what therapeutic confrontation looks like. And that's all I'm looking for. I'm not looking for data that I already know. I'm not going to try to figure out how I know it. I'm looking for an answer that says that is therapeutic confrontation. Tell me more about how you see the situation. That's not therapeutic confrontation. It's a good therapeutic statement for something else, but not in this situation. You say you're not a spouse abuser, but your wife has a restraining order against you. That's therapeutic confrontation. You just need to admit to your problem. Absolutely not. I hope nobody picks C. You won't get any better if you don't accept responsibility for bad behavior. Bad, bad, bad. Never say that. C and D are out. They're just plain bad. A is therapeutic, but not in this situation. The only one that's therapeutic confrontation is B. All right, 15. The paramedic squad calls you, a nurse in the ED, to give you a report on a client suspected to be experiencing heroin withdrawal. Which of the following pieces of equipment would you prepare? Yikes. All right, if I'd given you this question yesterday, you might have maybe guessed right, but probably not. So I don't know about you, but nobody told me what equipment I should have at the bedside of a patient with heroin withdrawal. And this is why people get frustrated with the NCLEX, because they get a question like this. They're like, I don't know. Nobody taught me that. Nobody has to teach you that. It's a conceptual question. So heroin. Heroin is not amphetamines, ADHD drugs, bath salts, caffeine, cocaine, PCP, or LSD. So it's got to be a downer. Okay, so heroin is a downer. Now, so the first thing you say is it an up or a downer? It's a downer. But it's withdrawal. So the symptoms are going to be up symptoms, right? So they're having up symptoms. So we're looking for equipment that would be used with up symptoms. That's what we're looking for. A tracheostomy set. Well, trach set is usually used with some kind of respiratory failure or airway problem, and that's not an up symptom. Endotracheal tube and ventilator, that's respiratory arrest. Not used, that's a down symptom, not an up symptom, and I'm looking for up symptoms. An ambu bag, well, that's used with respiratory arrest. That's a down symptom. I'm looking for an up symptom. A suction machine. Well, hypersecretions, okay, that's up. Seizure, might need to use that with a seizure. That's definitely up. So the only equipment that I can rationalize in any way that is used with an up symptom is D. And you don't have to memorize this. Don't memorize it. Do not memorize this. You say, how did I figure this out conceptually? If you have never been to our YouTube page, at the very on the home page of our YouTube page is an interview with Mark Klimek, where he talks about passing NCLEX, just generally strategies, general principles for passing NCLEX. If you have not passed NCLEX in the past, if you failed once, twice, 3 times, maybe more, watch that. He talks about how people who pass, how they think, okay? It's a very encouraging video, very encouraging. I strongly recommend that you watch it, particularly if you have failed in the past. All right, question 16. You're caring for your neonate born to a Quaalude-addicted mother 36 hours ago. You would expect to find which of the following symptoms. All right, Quaaludes are not amphetamines, ADHD drugs, bath salts, caffeine, cocaine, PCP, or LSD, so it's got to be a downer. So we're talking about a downer, and it's 36 hours. So are they in withdrawal or overdose? Well, they're in withdrawal, right? So if they're withdrawing from a downer, what symptoms are we looking for? We're looking for up symptoms, okay? So what symptoms would I expect? So I'm looking for up symptoms. Shrill, high-pitched cry. Yes. Exaggerated startle reflex. Yes. Low core body temperature. No. Significant respiratory depression. No, that's a down symptom. Difficult to console. Yes, that means they're crying a lot, right? So 1, 2, and 5 are the correct answers. Those are the up symptoms. All right, page 89, question 17. Page 89, question 17. You're precepting a nursing student in the labor and delivery unit. Oh, I hate maternity questions. Oh, man. You're currently caring for your neonate born to a methamphetamine-addicted mother. The baby's 5-minute APGAR score is 9. You're preparing to transport the baby to NICU. The student asks why a newborn with such a good APGAR score is going to NICU. You respond. All right, I've got a lot of things to say about this question, but let me just go ahead and just go through the question first, and then I'll talk about a couple things that I want to make sure that you know. Okay, so first we have a neonate born to a meth. So meth is that up or down? Meth is amphetamines, ADHD drugs, bath salts. Amphetamines is methamphetamines, right? So that's an upper. And it's a 5-minute APGAR score. So are they still overdosing or are they withdrawing at 5 minutes? Well, they're overdosing. So we're looking for up symptoms. So that's what we're worried about, up symptoms, just born to a meth addicted mom. But the APGAR score, so here you have to know APGAR score. If you don't know APGAR scores, they're in the blue book. But the top number for APGAR is 10. So that's a good APGAR score. It is a good APGAR score, 9 out of 10. But you're sending them to the NICU. And then the student says, why are you doing that? Now, you have to answer them. I'm going to tell you why in a minute, but you have to answer them. Do not pass off teaching to somebody else. So that means you got to cross off C. Teaching is nursing purview. Unless they ask you about, unless it's a pre-op consent, pre-op consents we don't teach. We just observe the signature. That's it. We witness the signature. We don't do teaching as it comes to pre-op consents. Other than that, we do all the teaching. Don't pass it off to anybody else. Okay, so that's first. Do not pass teaching off to anybody else. So now we have to say, well, why is that? This baby is critically ill and has the potential to seize. Well, sure. They're suffering from up symptoms. Seizure is up. This baby is severely depressed and may stop breathing. Absolutely not. So the correct answer is A. And honestly, you probably didn't even think that was a hard question. Honestly, you probably didn't. And you shouldn't have, even though nobody taught you this. Nobody taught you this. So do you